Okay guys, today we're talking about something that drives a lot of people crazy when they're on blood pressure medications, that persistent annoying cough. And the culprit, often it's lisinopril, one of the most commonly prescribed blood pressure pills in the world. If you've ever wondered why your throat feels like it's constantly irritated or why you just can't stop coughing after starting a new blood pressure medicine, this video is for you. I'm going to explain why it happens, what's actually going on in your body, and what you can do about it, all based on real science. Let's get straight into it, guys. All I ask from you is just to hit the like button down below. It tells YouTube this is worth showing to more people. So if you like learning about health from a scientific perspective in a calm and collected way, consider subscribing too. First, let's start with what lisinopril is, which, by the way, 76 million prescriptions for it were filled in 2023, which goes to show a lot of people are taking this one but might not know exactly what it is. It belongs to a class of drugs called ACE inhibitors, which stands for angiotensin converting enzyme inhibitors, that are used to treat high blood pressure, heart failure, and heart attacks. The main job of ACE inhibitors is to relax your blood vessels, lower blood pressure, and reduce strain on your heart. They're fantastic for protecting your heart and kidneys, especially in people with high blood pressure or certain heart conditions. But as amazing as they are, ACE inhibitors have a notorious side effect, a chronic dry cough. Now let's get into the science behind it. Normally, the ACE enzyme helps break down a molecule called bradykinin in your lungs. Bradykinin is a naturally occurring peptide, and when it builds up, it can irritate the airway and trigger your cough reflex. So when you take lisinopril, ACE is blocked, right? Bradykinin levels rise because of that, and that's what causes that persistent tickly cough. It's not an allergy, it's not a cold, it's literally your body reacting to higher bradykinin levels in your lungs. It's unclear why bradykinin stimulates this need to cough, but it's believed that it sort of stimulates some of the fibers in the lungs and the airways that trigger that natural response and almost trick the lungs into thinking they need to cough when they don't. Here's something that might surprise you. The cough can develop weeks or even months after you start the medication, and it can affect anywhere from 5% to 20% of people taking ACE inhibitors, depending on the study you read. Women and people of Asian descent are actually more likely to develop this cough. So if you notice a cough that seems to appear out of nowhere after starting lisinopril, it's not a coincidence. It's probably the med. Okay, so what can you do about it, right? First, don't ignore it. While the cough itself isn't dangerous, it can seriously affect your quality of life, cause sleep disruption for some folks, and even trigger headaches or chest discomfort from constantly coughing. The most effective solution is talking to your doctor. Often, the simplest approach is to switch to a different type of blood pressure medication, like an angiotensin receptor blocker or an ARB. ARBs work similarly to ACE inhibitors in terms of lowering blood pressure, but don't affect bradykinin, so the cough usually disappears. Most studies show that the cough improves substantially within about 1 to 4 weeks. However, several reviews and cohort studies do note that in a minority of patients, the cough can take up to 3 months to fully resolve. There are also some self-care tips that can help while you're on this medication, like staying hydrated, using a humidifier, or even honey and warm teas can soothe the throat a little bit. But honestly, these are mostly temporary measures. If the cough is persistent, switching medications is usually the only real fix. And here's the important part, guys. Don't just stop your lisinopril on your own. Blood pressure medications are crucial for heart and kidney protection, and suddenly stopping can be dangerous. Always work with your healthcare provider to find a safer alternative if the cough becomes unbearable. If this video helped you in any way, go ahead and hit that like button. It tells me you want more videos breaking down side effects and what actually is happening in your body. And of course, if you have questions about lisinopril, ACE inhibitors, or managing side effects, drop them in the comments. I'll be reading and responding. Stay informed, pay attention to your body, and I'll see you guys on the next one.